The sympathetic nervous system brings about our fight or flight response. This is how our body acts when we come face to face with a bear, for example. Our heart rate increases, our mouth gets dry, our digestion is inhibited, breathing improves, and our pupils constrict. And all of these actions are opposite to that of the parasympathetic nervous system. So, how does it work? Well, the sympathetic nervous system is made up of neurons that release neurotransmitters, namely norepinephrine. And norepi binds to adrenergic receptors, of which there are 4 types, each with a different action. So when norepi binds to an alpha 1 receptor, we see smooth muscle contraction. This means vasoconstriction and an increase in blood pressure, as well as decongestion. Beta 1 receptors stimulate the heart, so it beats faster and stronger. Beta 2 receptors cause smooth muscle relaxation, namely bronchodilation. And alpha 2 receptors are different from the rest. They actually prevent release of norepinephrine. So the actions here are opposite to that of the sympathetic nervous system. Here we see vasodilation, decreased blood pressure, and a slowed heart rate. Now, drugs that act on the sympathetic nervous system either promote these actions or prevent them. And they do that by acting as agonists or antagonists. So an adrenergic agonist acts like norepinephrine and binds to an adrenergic receptor, bringing about its action. So an alpha 1 agonist, we know, should cause smooth muscle contraction. So these drugs actually cause vasoconstriction, which increases heart rate and causes decongestion. Oxymetazoline is an example of an alpha 1 agonist added to nasal sprays for decongestion. Beta 1 agonists stimulate the heart. Dobutamine is an example of a beta 1 agonist used to stimulate the heart in patients who have hypotension or cardiac problems. Beta 2 agonists, we know, cause bronchodilation. Albuterol is an example of a beta 2 agonist used to treat asthma. Alpha 2 agonists, we know, prevent that sympathetic nervous system response. So these drugs actually decrease heart rate and decrease blood pressure, making them useful for treatment of hypertension. Clonidine is an example of an alpha 2 agonist used as an antihypertensive. Now, adrenergic antagonists block receptors and they prevent these responses. Prazosin is an example of an alpha 1 antagonist. It blocks the receptors, preventing smooth muscle contraction. This means it brings about vasodilation and a decrease in blood pressure, making these drugs useful for treating hypertension. Atenolol is an example of a beta 1 antagonist or a beta blocker. They prevent heart stimulation, slowing heart rate, and decreasing blood pressure, also making these drugs useful for treating hypertension. And that's it. Thank you for watching.